Okay. So, good afternoon, class. So, for our lesson this afternoon, we will have the discussion on lesson 4, hemoglobin, and its corresponding hemoglobinopathies. So, let's start now. If you have your handouts, you may use your handouts as a guide, and that is where your quiz will be based next week. Now, your hemoglobin class, this is an iron-bearing protein. Now, if you recall, di ba, in our lesson 1, it transports mainly your iron. Now, it is also a respiratory protein class. Why do you think it's called a respiratory protein? What's the reason why it's called a respiratory protein? Bakit siya tinatawag na respiratory protein class? Yes, bakit siya tinatawag na? Okay. Responsible for carrying oxygen. What else aside from oxygen class? Ano pa yung kinikerry niya? You have your carbon dioxide. Alright. So it accounts for 85 to 90% of your total RBC content. So your RBC class contains 85 to 90% hemoglobin. It serves as the vehicle of transport for oxygen from the lungs to the tissues and carbon dioxide from the tissues to the lungs. Class, which type of vessel does your oxygen is your oxygen from the lungs to the tissues found? Anong saan siya dumadaan? Alright, it's your arteries. How about your carbon dioxide class? Anong vessel? Okay, it's your veins. Very good. Kasi capillaries niya, class. What's your composition ng capillaries niya? So, anong meron sa capillaries niya, class, if you recall? Okay, exchanges of gases. Pero your capillary blood is made up of what? Your capillary blood is made up of what? La. Your capillary blood. Okay, we have this tissue fluid, oxygenated. So it's composed of your capillary, your venous blood, and your arterial blood. So yun ang composition niya. Now, in the tissues class, hemoglobin has around 20 millimeter mercury of tension force. Class, have you heard of mmhg? Saan aparatus to nakikita? Saan aparatus or device to nakikita sa measurement class? Yes, thermometer. Okay, that's good. Aside from the thermometer, isa pa. Aside from the thermometer, what else? Okay, so it's your BP cuff, ha? So blood pressure class. So let's take a look at it. Sabi dito class, sa tissues, hemoglobin has around 20 millimeter mercury of tension force. Thus, it only combines with 30% oxygen. Thus, the lower the tension force, the lower the capacity of hemoglobin to combine with oxygen. Okay? The lower the tension force, the lower the capability of combining with oxygen. So, kapag nasa tissues siya, 20 millimeter mercury lang na tension force ang kaya niya. Thus, 30% lang ng oxygen. Now, kapag nasa lungs siya, class, hemoglobin has around 100 millimeter mercury of tension force. Thus, very saturated. When you say saturated, punong-puno with about 95% of oxygen. Okay? So kapag tinanong sa quiz nyo, in which part of the body does your hemoglobin have around 20 millimeter of mercury tension force? It's in the tissue. While kapag tinanong which part of the body does your hemoglobin has around 100 millimeter mercury of tension force, it's your lungs. Now, about 90% of the total body iron is found in hemoglobin. Ganon kalaki class na nakikita siya sa blood sa hemoglobin. Now, only 10% is found in the plasma and tissues. Now, let's look at the different classifications of your iron. Now, the storage form of iron class is known as your ferritin. Now, this ferritin can be found in your tissues. Then there's another type. We have your transferrin class. Transferrin from the word trans, meaning to transfer, to move. Transferrin, which means protein that transports iron. And then lastly, class, the molecular weight of hemoglobin is 64,500 daltons. Okay, any question for this slide? Right, let's proceed to the next. Now, hemoglobin functions include class, this is just a recap of your lesson 1. Transport oxygen from the lungs to the tissues and carbon dioxide from the tissues to the lungs. It assists in acid-base regulation by the buffer action. Class, na-recall nyo, diba ang pH ng blood is 7.45. It should be maintained this way. Now, kapag si pH nyo bumaba, let's say naging 7.44, this is what you call acidosis. Acidosis means making your blood acidic. Now, what if naman naging greater than 7.45? It becomes 7.46. This is more alkaline. Now, class, we have what you call the buffer system of the body. The buffer system of the body involves your lungs and your kidneys. I will not divulge further on this. I'll just give you a brief topic kasi sa CC2 nyo to i-discuss, tong buffer system na to. Kasi may mga computation yan. You have to consider yung oxygen saturation, partial carbon dioxide saturation, and so on and so on. So class, kapag nagkaroon ng problem sa lungs nyo, sa kidneys nyo, like sa lungs, for example, sa transport ng hemoglobin, it could lead to either acidosis in the form of what you call metabolic, either metabolic or respiratory acidosis. The same with alkalosis, class, meron din tayong metabolic alkalosis and respiratory alkalosis. Depende kung aling sa dalawang yan yung may problem. So I won't divulge kasi sobrang tagal yan pag in-explain ko, baka maubos yung time natin. So just remember, class, if your pH of blood is greater than 7.45, it becomes alkalosis. If less than 7.45, it becomes acidosis. Okay. Proceed to the next slide. Now, class, let's go to your hemoglobin structure. Your hemoglobin structure, class, is composed of number 1, 4 globin chains. Class, naalala nyo sa adult hemoglobin? Class, ano yung globin chains ng adult hemoglobin, if you recall? What are the globin chains of your adult hemoglobin? Okay, no, malapit na, Christian. Palitan mo lang yung nasa dulo. Okay, we have your 2 alpha and 2 beta globin chains, class. This is where the 4 globin chains come from. Dalawang alpha na globin chains, dalawang beta na globin chains. Now, this is the protein part. Now, it is synthesized in the cytoplasm. So kapag tinanong kayo, what do you call the protein part of the hemoglobin, it is the globin chains. The globin chains class. Class, what is the building block of your protein? What is the building block of your protein class? All right, very good. It's your amino acid. Amino acid. So we will discuss that later. The amino acid. No? Next part class ng hemoglobin structure nyo class is your, it contains 4 protoporphyrin 9 molecules. Protoporphyrin 9 molecules. This is the nitrogenous part of your hemoglobin. Then it also contains 4 molecules of ferrous iron. Ferrous iron, which is the type of iron that can bind with oxygen. Then we have one molecule of 2,3-DPG, which is synthesized in the Rappaport-Lewis bearing pathway. Class, iron is maintained in the ferrous form by the enzyme methemoglobin cytochrome C reductase. 2,3-DPG regulates the affinity of hemoglobin to oxygen. Class, when you say regulate the affinity, meaning regulate, controlling the binding capability. So imagine nyo class, ito yung hemoglobin molecule nyo. Sa loob ng hemoglobin molecule nyo class, merong 1, 2, 3-DPG dyan. Now, normally, nasa loob yan. Nasa loob yan. But in cases na kapag na-synthesize na siya sa Rappaport-Lewis bearing pathway, si 2,3-DPG nyo class, lalabas yan. Lalabas yan. The moment na lumabas yan, pwede na siyang mag-bind. Pwede nang mag-bind with oxygen ang hemoglobin nyo. Naintindihan? So kapag nagkaroon kayo ng problem dito sa pathway nyo ng Rappaport, pag i-stay si 2,3-PG dyan, hindi makakapag-bind si oxygen, ay si hemoglobin sa oxygen. Okay? Nagets? If your 2,3-DPG is inside, hemoglobin cannot combine with your oxygen. So let's proceed to the any questions. So again, your 4 globin chains, protein part, protoporphyrin 9. This is 9 class, Roman numeral 9. Nitrogenous part, 4 molecules of ferrous iron, 1, 2, 3-DPG synthesized in the Rappaport-Lewis bell. And don't forget the enzyme class, methemoglobin cytochrome C reductase. Okay, we have the physiologic forms of hemoglobin class. These are the forms of hemoglobin that can be found in the blood. We have your oxyhemoglobin. From the word oxy, meaning hemoglobin in combination with your oxygen, it gives pinkness to the skin and mucous membrane. Class, what do you usually see in a person na laging puyat? Laging puyat, malnourished, walang kain. Anong nanonotice nyo sa balat? Yung eye bags. Ano, it's pale. What else? What else? Give me a color. Bigyan nyo ako ng kulay, class. Tingnan nyo yung eye bags ng classmates nyo if you're able to see them. Dark, black. Okay, meron tayong we call bluish black. So, if makikita nyo yung eye bags ko, class, yan. Yan nangyayari kapag puyat ka and you have lack of oxygen sometimes. So again, your oxyhemoglobin gives pinkness to the skin and to their mucous membrane. Now, let's go to the second type, the non-oxygenated or the reduced hemoglobin. This hemoglobin class is unassociated with oxygen. Class unassociated siya sa oxygen. So what do you think is the one that combines with your hemoglobin sa case na to? Ano sa tingin nyo, class, yung nagko-combine sa oxygen? Alright, very good, Ms. Chongson. It's your carbon dioxide. It gives blueness. Blueness to the skin and your mucous membrane. So, kapag tinanong ng what physiological form of hemoglobin gives pinkness to the skin and mucous membrane, it's your oxy. While for those that gives blueness to the skin, it's your non-oxygenated or reduced hemoglobin. Now let's go to the next one. Let's go to iron metabolism. Now, your synthesis of hemoglobin class contains two. One is the heme, and the second is the globin or the protein part. Class C heme, yan yung iron within the hemoglobin molecule. While the globin, these are your chains, this is the protein part. Now, heme synthesis class, this occurs in most red cells of the body, except class ha, the mature RBC. But very abundant in erythroid precursors. So class, pag tinanong kayo, at which stage does heme synthesis stop? Your answer is mature RBC. Mature RBC. Next, we have your globin synthesis. Again, this occurs in the cytoplasm of your young erythrocytes or your erythroblasts. As hemoglobinization occurs, when you say hemoglobinization, the start of the production of hemoglobin. This starts as early as polychromatophilic normoblasts until reticulocyte stage. Remember class, your hemoglobinization or production of hemoglobin starts as early as polychromatophilic normoblast stage until the reticulocyte stage. Now, your mature RBC contains 3 million molecules of hemoglobin. Imagine ka, so sa isang RBC, there are a lot of molecules. 3 million molecules of hemoglobin. Now, 600, plus this is milligrams, sorry. 600 milligrams of hemoglobin is capable of combining with 800 ml of oxygen. So class, ito tanong, 1800 milligrams of hemoglobin, gaano kadaming oxygen ang kaya niyang i-bind? 1800 milligrams of hemoglobin. Ilang ml ng oxygen ang kaya niyang i-bind? Okay, very good. So, it's 2,400. 2,400 ml. Riniplay ko lang siya, class. This is milligrams. Nagets siya bakit naging 2,400. Kasi 600 grams of hemoglobin is capable of combining with 800. So, 600 times 3 is 1,800. 800 times 3 is 2,400. Thus, 1 gram of hemoglobin can combine with 1.34 ml of oxygen. Kapag tinanong kayo, class, how many grams of 5 grams of hemoglobin can combine with, ano sagot niya, class? How many ml of oxygen ang 5 grams? Ano sagot, class? 5 grams of hemoglobin can combine with how many ml of oxygen? Alright, very good, Ms. Torres. It's 6.7. So you just multiply it by 5. So don't forget those. Okay, let's go to the next class. This is the appearance of your hemoglobin molecule. This is your hemoglobin molecule. Class, itong mga nakikita niyong parang chains, this is the globin chains niya. So, one globin chain, one set, third set, fourth set. Now, it contains your heme. So, ito yung heme nyo, class. 4 yan na heme molecules. Sa loob ng heme molecules nyo, class, merong iron. Then, sa loob ng iron, nandun yung oxygen molecules. Ulitin ko, class, ha. This is your globin chains. So, apat yan. Sa loob ng globin chains nyo, class, din na makikita yung heme nyo. The heme molecule nyo, class, dandyan sa loob yung iron. Along with the iron, you have your oxygen, which is being bounded. Intindihan? Next, let's go to your normal hemoglobin class. So your normal hemoglobin class first is your embryonic hemoglobin. Class, quick recap nga. At what stage do you find your embryonic hemoglobin sa hematopoiesis? At what stage? Do you recall? At what stage? At what stage is your embryonic hemoglobin produced? Anong stage class ng hematopoiesis? Diba tatlo yun? Okay, very good. It's your mesoblastic stage. How about your fetal hemoglobin class? At what stage? Your fetal. It's your hepatic. Very good. How about your adult class? Nature medullary. Very good. Okay, let's go and analyze them again. Your embryonic hemoglobin class. These are found in normal human embryos and fetuses less than 3 months old and is usually absent at birth. So wala na kayong embryonic hemoglobin the moment na iiniri na kayo ng nanay nyo. The types of embryonic hemoglobin class, there are 3 types. This is your Gower 1, Gower 2, and Portland. Si Gower 1 yung class, meron 2 zeta and 2 epsilon globin chains. Si Gower 2, 2 alpha and 2 epsilon globin chains, while your Portland has 2 zeta and 2 gamma globin chains. So na-notice nyo class, it's always 4 and there is always 2 pairs lagi sila. Now, let's go to your fetal hemoglobin. Your fetal hemoglobin, this is the major hemoglobin of fetuses and newborns, composed of 2 alpha and 2 gamma globin chains, produced 4 months after consumption. And next, you have your adult hemoglobin. Adult hemoglobin class is 95 to 97% of hemoglobin in normal adults and is produced 1 year onwards. Composed of 2 alpha and 2 beta globin chains. Now, di ba tinanong kayo, class, what's the building blocks of your protein is your amino acid. Now, since yung globin chains nyo are protein, you expect them to have amino acids. Now, your alpha globin chains have 141 amino acids. Your beta globin chains have 146 amino acids. Now, the appearance of your normal hemoglobin molecule is ellipsoidal. Ellipsoidal class. Class, what's the shape of your RBC? Anong shape ng RBC niyo? Concave, very good. With 4 heme groups on the surface. Wala naman nagkamali doon sa quiz niya kahapon sa shape ng ano. Wala naman sumagot ng oblong, wala naman sumagot ng ano, so very good. Okay, let's go to another form of your adult hemoglobin class. First is your glycosylated hemoglobin. It is 5% of your adult hemoglobin. It is produced when adult hemoglobin undergoes linkage to sugars to your amino acid serine, asparagine, and hydroxylsin residues. So class, kapag yung hemoglobin molecule nyo, specifically yung adult hemoglobin, nag-connect siya from yung sugars niya with amino acids, serine, asparagine, and hydroxylin residues, you will have your glycosylated. Now, class, si glycosylated nyo, may 3 klase yan. Si HbA1a, si HbA1b, and si HbA1c. Huwag nyo na itong pakialaman. You do not need to know this sa practice nyo sa hospital. This is what you need to know. HbA1c. Si HbA1c nyo, class, this is a marker for testing diabetes mellitus. Class, sa diabetes mellitus, sino dito may kamag-anak na diabetic? Sino dito ang may kamag-anak na diabetic? Wala kayong kamag-anak na diabetic. Okay. Let me ask you, to those who have relatives with diabetes, what's the test used to assess diabetes? Ano yung common test sa laboratory, class? Alright, it's your FBS, also known as your fasting blood sugar. Now, kapag ang FBS ng pasyente nyo is mataas, suspected yan na diabetic. Now, what the doctor will do is they will ask your HbA1c test. The reason for that, class, because it is used as an index of metabolic control. Class, when you say index of metabolic control, they will use it as a basis if your body is coping well or having a hard time dealing with diabetes during the last 2 to 3 months. Okay? They want to know if you have mild or severe diabetes. Kailan ka pa nagkaroon ng diabetes? Was it months ago, years ago? So that's the reason why para malaman nila yung severity at kung kaya ba ng body mo i-maintain yung pagkaroon ng diabetes. Now, let's look at the normal values, class. The normal values for HbA1c are less than 5.70. If you are pre-diabetic, when you say pre-diabetic, class, ang borderline, malapit ka nang maging diabetic, 5.70 to 6.40%. Then, if you have diabetes, it is greater than or equal to 6.50%. So, madalas, class, ang na-experience ko sa work ko, pag mataas ang FBS nila, mataas din ang HbA1c. Pero may mga rare cases naman na pumapasok siya sa pre-diabetic. This is based, class, on the American Diabetes Association. So we follow this standard sa Pilipinas. This is what they call this. This is their basis for the normal values ng HbA1c. Then another form of your adult hemoglobin is your HbA2. This constitutes 1.5 to 3.5% of your total adult hemoglobin. It is composed of 2 alpha and 2 delta chains. Then another one is your A3. This is the degradation product. So when you say degradation product, class, in case na itong A2 masira na, it can be replaced by HbA3. HbA3, class, is composed of 2 alpha and 2 delta chains as well. Okay, any questions, class, for this? None. So, for none, I'll proceed to the next. Next, let's go to your abnormal hemoglobin, class. Class, the first one is your hemoglobin S. Now, if you're looking at the slide, you can see alpha 2, beta 2, 6 val. Now, your alpha 2, beta 2 here in this part, this represents your globin chains. So, 2 alpha, 2 beta. Now, the 6 valine, I'll discuss this in a bit. Now, your hemoglobin S, class, causes sickling of the RBC due to reduced oxygen concentration. Class, sickling. Anong itsura ng sickling, class? How would you compare sickling to a shape? It's your crescent moon. And then bana. Yan, ganyan, class. Parang boomerang, crescent. It's a crescent moon. Kaya yung sickle yung pangtabas ng palay. So now class, your hemoglobin S class is confined to black race. So common to sa mga African Americans and Americans. Now, it replaces glutamic acid into valine in the sixth position of the beta chain. Class, do you recall yung sinabi ko kanina that there are amino acid sa bawat beta chain, sa chains nyo? Now, sa case na to class, pinalitan daw ni valine yung glutamic acid. So example kasi ito yung beta chain nyo. Ito yung beta chain nyo. The beta chain nyo class is composed of different amino acids. So ilan ang amino acids class ng beta chain? Ilan? Kanina sinabi ko, ilan? How many acids does your beta chain contain? Alright, very good. It's 146. So imagine class 146. Now, sabi dito, 6 positions. So, first position, second, third, fourth, fifth, sixth. Originally class, ang amino acid dito sa 6 position nyo is glutamic acid. Glutamic acid. Now, due to certain factors, whether it's disorder, whether it's hereditary, si glutamic acid class, pinalitan, inagaw ni valine, leading to what you call hemoglobin S. Okay, naintindihan class? Nagkaroon ng replacement. Instead of glutamic, yung nasa 6 position ng beta chain niya, naging valine, causing your hemoglobin S. Okay? Naintindihan class? Any questions? Okay. Next, we have the two types of your hemoglobin S. We have your homozygous and your heterozygous. Class, si homozygous nyo, HBSS, causes sickle cell anemia. While your heterozygous, HBAS. Bakit A? Remember class, this is a type of adult hemoglobin. Kaya nga 2 alpha, 2 beta. Heterozygous HBAS causes sickle cell trait. Now, let's look at it in an explanatory basis. In your hemoglobin S class, there is the oxygenation, meaning walang decrease ang oxygen nyo. This deoxygenation leads to sickling of cells, including acidity and 2,3-DPG. Remember class, kanina sabi ko, si hemoglobin molecule nyo, meron niyang isang molecule ng 2,3-PG. Kailangan ni 2,3-DPG lumabas para pumasok si oxygen. Sa case na to, since may problem sa shape, hindi makalabas si 2,3-DPG nyo, nagkakaroon kayo ng deoxygenation kasi hindi siya makabind sa oxygen dahil nandun pa rin siya sa loob. Naintindihan? And it causes acidosis or acidity. Now, in your homozygous, sickling happens when oxygen saturations reaches less than 85%. While in heterozygous class, it reaches less than 40%. Sickling causes pain, characterized by vaso-occlusion. Class, when you hear the word occlusion, what comes into your mind? Occlusion. The word occlusion. What comes into your mind when you hear the word occlusion? Comes into your mind, class, when you hear the word occlusion? Vaso-occlusion daw, class. Alright, very good. It's your blockage, pagbabara. So we have your vessel blockage class. Now imagine nyo, sa sickling, yung sickle cells nyo, binabara niya yung vessels nyo, which could lead to pain. Now, to treat this class, para gamutin to, they have to perform repeated cycle of oxygenation. Oxygenation. Para mabalik sa normal yung shape niya. So kahit pa paano, reversible pa rin siya. Intindihan? Okay. It is usually symptom-free in the first 6 months of life due to fetal hemoglobin. So may mga fetal hemoglobin pa kasi. Hindi pa siya nagiging adult hemoglobin. Remember, the one being affected here, class, is 2 alpha to beta chains. So it usually is common, nangyayari yun sa adult. Dahil since sa first 6 months mo, naka-fetal hemoglobin ka, hindi pa siya symptomatic. Pero once na mayroon ka ng adult hemoglobin, susceptible ka na to hemolysis and can lead to anemia and prominent splenomegaly. Class, what does splenomegaly mean? The word mega. Splenomegaly. Okay, enlarged spleen. You have your enlarged spleen. Size of your spleen. It can also produce crisis, class. When you say crisis, this is a very, very hard or difficult pain associated with your respiratory tract infection and may progress to autosplenectomy. Class, autosplenectomy, can you expound on that? What does it mean? Autosplenectomy. Remember, class, you have your appendectomy. So what does your autosplenectomy mean? Autosplenectomy. Okay, taking out the spleen, removal of the spleen. Now, sa case na to, class, nagkaroon siya ng word na auto. What does your auto mean? Okay. So, nangyari dito, class, auto, self-removal of the spleen. So, nangyari dito, class, your body decided to remove the spleen by destroying it. Sobrang sakit niyan. Imagine the pain, the crisis. That is usually due to infection. Okay? Now, you want to see your hemoglobin S. Gusto mo makita siya in the laboratory. You can perform electrophoresis. Now, sa electrophoresis class, you have this gel. Then sa gel class, magkakaroon ng mga bands. So sa case nito, your electrophoresis will show 3 types. First band is your hemoglobin S, which contains 80 to 95%. So ibig sabihin, sobrang dark niyan dito. Then your fetal hemoglobin, 0 to 20%. So pwedeng onti lang. Depende sa ano. And a normal amount of HbA2. So meaning very few. Baka nga sobrang pale lang ng ano dyan. Then you want to perform your testing for sickle cell. So you have what you call your sickle cell solubility test. So ang reagents nito, class, is saponin and dithionite. Saponin and dithionite will lyse yung hemoglobin S, converting ferrous to ferric. Now, in this reduced form, sa ferric form niya, liquid crystals would form and turbidity as well. So your positive result for this class is turbidity. Now, we have hyperlipidemia and too much blood. Class, what does the word hyperlipidemia mean? Hyperlipidemia. Hyperlipidemia. High level of lipids in where? Saan? High level of lipids in where? Saan? In your blood. So, sobrang turbid niyan, class. Then, pansin nyo in the future, if you're gonna extract blood from patients na matataba or obese, manonotice nyo pag sinentrifuge yung sobrang kapal or sobrang taba ng fat layer doon. Then we have your false positive, hyperlipidemia, too much blood. False negative, class, infants, less than 6 months. Class, bakit sa tingin niya magpo-false negative siya sa infants less than 6 months? Sige, tingnan nga natin kung naintindihan niyo yung explanation ka kanina. Bakit sa tingin niyo magpo-false negative siya sa infants in less than 6 months? Yeah? Let's see. So ano ngayon kung fetal hemoglobin ang majority? Okay, siya. Ano meron kung ano? Okay, very good. Kasi adult, di ba? You're looking for your 2 alpha and your 2 beta. Eh, nangyayari lang yung mutations na yan sa 2 beta, di ba? Sa 6 position. So, pag fetal hemoglobin pa, di siya na-detect. So, false negative ka. And low hematocrit. Then, another test class is your sickle cell sodium metabisulfite. So, this is, when you add class yung sodium metabisulfite sa blood, this will artificially cause sickling. Kapag nag-sickling yan, yun ang positive result. Ulitin ko class ha, sodium metabisulfite is mixed with blood. Kapag na-mix sa blood, it will cause sickling. Kapag nag-sickling, positive. Pero kapag normal pa rin yung shape, it's a negative. Any questions for your hemoglobin S? Naintindihan naman class ha kung bakit nag-false negative siya in less than 6 months. Next class, we have your hemoglobin C, alpha 2, beta 2. So 2 alpha 2 beta chains again. So this is again normally an adult hemoglobin. And sa case na to class 6 lysine. So again, yung 6 position, class anong amino acid dapat yung nandito? Anong normal na amino acid for this? The glutamic acid. Ngayon, sa case naman na to, tinalitan ni lysine. Si lysine naman yung nang-agaw instead of okay? So this is again found sa black race. Substitution of glutamic acid by lysine in the 6th position of the beta chain. Then target cells class. This is the hallmark class sa hemoglobin C nyo. Target cells are often seen. Then hemoglobin C crystals are also precipitated. Often seen in combination with hemoglobin S. So kaya niyang mag-combine with hemoglobin S, producing what you call hemoglobin SC. So let's have a short break. A 2-minute break kasi alam ko naman is your hemoglobin na to magsulat recording for this. So to those na hindi ganado magsulat sa notes, you can do it na. Okay, so let's resume. Now, another abnormal hemoglobin class is your hemoglobin D. Now, your hemoglobin D class is composed of several variants. So, I'd like to take note class yung homework nyo. So, good job on finding those variants. It's nice to see na nag-research talaga kayo and you even take note of those variants. So, the most frequent variant class sa hemoglobin D na maki-encounter nyo is, is your Punjab and your Los Angeles hemoglobin. So very common to, I think, in India and in South America class. South America. It has the same electrophoretic mobility as your HBS, but no sickle cells are observed. So, kapag sa electrophoresis class, nakita niyo yung 3 bands na yon. Yung HBS nyo sobrang kapal, yung fetal onti lang, yung adult, yung A2, very small amounts. Pero pag tinignan mo under a microscope sa blood smear, walang sickle cell, then most likely it's a hemoglobin D variant. So kapag tinanong kayo, what's the difference between HBS and HBD? HBD has no sickle cells. Okay? Then we have your hemoglobin E, has the same electrophoretic mobility as A2. So tandaan niyo yung class ha, pag tinanong which has the same electrophoretic mobility as A2, it's your hemoglobin E. And associated with thalassemia. So most common hemoglobinopathy in the Philippines. So siya yung pinaka-common nandito sa Pinas. Then we also have your hemoglobin H class. Consists of 4 beta chains associated with alpha chain disease and thalassemia minor. Plus yung alpha chain disease na yan, I will discuss that along with your anemia. Pati rin si thalassemia class in future So normally class, di ba, 2 alpha, 2 beta kayo. But in this case, naging 4 beta chains lahat. Nawala yung 2 alpha. Then, Sa hemoglobin Bart's class, abnormal variant ng hemoglobin F. Di ba ang fetal hemoglobin class is 2 alpha, 2 gamma. Ang nangyari, nawala si 2 alpha. Naging puro gamma na lang sila. 4 gamma chains. Pag tinanong kayo, the type of hemoglobin with 4 beta chains, it's your hemoglobin H. The type of hemoglobin with 4 gamma chains, it's your Bart's hemoglobin. Next, let's go to your abnormal hemoglobin pigments. So class remember, si hemoglobin nyo, this is a pigment in the blood. Now, normally class, ang kinocombine niya is oxygen and carbon dioxide. Now, kapag nawala si oxygen class, magkakaroon ka ng hypoxia and cyanosis. Class, what does cyanosis mean? The word cyan, tapos no osis. What does it mean? Cyanosis. What does the word cyanosis mean? A bluish discoloration of the skin. So, bluish. Hypoxia, low oxygen, difficulty breathing. Okay? Now, since hindi na, wala na si oxygen class, hindi siya makabind sa hemoglobin, other elements can now combine with your hemoglobin. An example would be your carboxy hemoglobin. Now, carboxy hemoglobin class, this is your hemoglobin in combination with carbon monoxide. Nasa monoxide, hindi dioxide. This is commonly found in the blood of tobacco smokers in concentration of 1 to 10%. Ang symptoms ng carboxyhemoglobin poisoning, magiging poison ka lang class if your concentration sa blood reaches 20 to 30%. It can include headache, nausea, dizziness, and muscular weakness. So siguro class mangyayari lang to siguro kung mga nakakalimang kaha ka ng sigarilyo sa isang araw, 10 kaha ng sigarilyo, pero kung if you're a light smoker or it will take a long time. But then again, I have no experience. I've never tried smoking. And then we have your methemoglobin, also known as your hemoglobin, and ferrihemoglobin. Now, hemoglobin class in the ferric form is unable to combine or transport oxygen. Now, since it is unable to combine with your oxygen class, it will be replaced, instead of oxygen class, a hydroxyl radical. Hydroxyl radical will replace it. This can be acquired due to exposure to drugs and chemicals such as nitrates, nitrites, quinines, chlorates. And it can be inherited due to structural abnormality of the globin chains and can also be due to RBC enzyme defects in which hemoglobin cannot be converted into the reduced form of hemoglobin. Class, ano tong enzyme na to based on your lesson 3? Wherein it reduces your ferric to ferrous form of hemoglobin class. In your lesson 3, anong enzyme to? And anong pathway to maano? Anong pathway tong defect na to and anong enzyme class? Come on. Methemoglobin. Anong enzyme? Pag class to lesson 2 natin yan, anong enzyme yan? Alright, very good question. It's your cytochrome. Very good Dennis Lapidus. Is Pabingwit. Your methemoglobin reductase or your cytochrome B5 reductase. Anong pathway to class ng involved? Itong inherited na to. So your MRP. Ito. Methemoglobin reductase pathway. So class, pag nagkaroon kayo ng problem sa MRP nyo, you will have your methemoglobin, usually inherited. And then this exposure to drugs, class, and chemicals, this can rarely happen. But if you're working in a very toxic environment, let's say you're a chemist, you're an industrial worker, there's a possibility. Pero in most cases, it's usually inherited, but very rare to happen. Then another class is your salt hemoglobin. So this is the hemoglobin combined with sulfur dioxide. Sulfur dioxide. When present, class formation is irreversible. Naalala nyo class kanina sa hemoglobin S natin, di ba nakasikling yon. Kapag nakasikling yung cell, pwede mo siyang gamutin or pwede mo siyang i-reverse by increasing yung oxygenation. Pero sa case na to, no matter what you do, yung presence ng self-hemoglobin is irreversible. It remains for life in the RBC. And this can be formed by certain drugs and chemicals such as sulfonamides and aromatic amides. Can combine with carbon monoxide in class for producing carboxysulfhemoglobin. Carboxysulfhemoglobin. Normal concentration in the blood is less than 1% or absent. So kapag tinanong kayo sa quiz nyo, what hemoglobin can combine with, what abnormal hemoglobin can combine with carbon monoxide, it's your sulfhemoglobin, producing what we call carboxysulfhemoglobin. So, I'll go to the next slide. So, class, ito yung pathophysiology ng deoxygenation. So, remember your homozygous hemoglobin S. Then we have your hemoglobin S beta thalassemia, your hemoglobin SC, combination of hemoglobin S and C, your heterozygous, producing your sickle cell trait. So here the HBS class. Marami. Then other cells that are involved. Clinical features. So sabi ko class, diba kapag may hemoglobin S ka, ay hemoglobin C ka, common ang target cells. Then splenomegaly, no splenomegaly, rare splenomegaly. I'll go to the next slide. So, natuwa ako kasi class, I included this in the reporting. So, this is your homework. So, most of you got it right naman. You were able to get the proper variants. So, may hemoglobin O, Arab, hemoglobin D, Punjab. Then, let's go class to another type of hemoglobin. We have what you call plasma hemoglobin, also known as your free hemoglobin. Class, when your RBC lyses, where does your hemoglobin go to? Kapag nag-lyse yung RBC nyo, class, sa loob ng body nyo, where does it go to? In ADS. Saan pumupunta ang hemoglobin nyo? Nope, it's not the organ, no? Okay, blood circulation. It's here sa clue class. It's still in the blood, but which part of the blood does it go to? Tandaan niyo yung parts of the blood class, di ba merong sa loob ng body, Miss Chongson, what do you call that inside the body? It's plasma. You don't call it serum plasma pag nasa loob ng body ka. It's your plasma. So, whenever your RBC lyses, the hemoglobin goes out and goes into your plasma. Now, that's why it is called plasma hemoglobin. Okay? Now, the normal values class of your plasma hemoglobin is 2 to 3 milligrams per DL. Now, it can be increased. Let's say if your plasma hemoglobin is 5 to 10 milligrams per DL sa plasma nyo, you can notice a yellow or orange plasma. In cases naman na greater than 10 milligram per DL, you have a pink plasma. Plus, ang pinaka na-encounter ko pa lang dito is itong yellow and orange plasma. Never pa ako na-encounter ng pink plasma. Then, we have your 25 to 39 milligram per DL. You have your hemolytic anemia. Plus, what happens kapag may hemolytic ka? Hemolytic anemia ka? Ano nangyayari sa red cells niyo? Bakit sa tingin nyo ganyan siya kataas? What happens in your hemolytic anemia? What happens to your red cells class in hemolytic anemia? Okay, they are lice, nasisira. Now, kapag in hemolytic anemia kasi class, almost all of your red cells are lice. So since lice ang maraming RBC nyo, increase din ang release ng hemoglobin nyo, leading to what you call a very high amount, which is 25 to 39. That's what happened. Now, another very rare case is your 40, greater than 40 milligrams per DL, seen in intravascular hemolysis. So maraming klase ng intravascular hemolysis. Now, let's tackle them one by one. We have your HTR, also known as your hemolytic transfusion reaction. Transfusion reaction. Miss Ocarisa, andyan ka ba? Teka, andyan ka? Miss Ocarisa. How about Miss Malinaw, are you there? Okay. Miss Ocarisa, what's your blood type? Do you know your blood type? O positive. Now, if you are O positive, can you receive blood type A? Okay, very good. No. Now, imagine if you went through an accident, pero wag naman. Then you needed blood. Then, yung medtech na mistype na mali yung pag-blood type sa inyo. Ang blood type sa'yo, kala niya ang blood type mo A. Now, kumuha kayo ng blood bag na blood type A, sinalin sa'yo, transfuse sa'yo. Remember class, when your body detects foreign substances, your body, your cells, your antibodies will attack those cells. Ngayon, dumating yung A positive na blood ni Ocarisa. Siyempre, hindi ma-detect ng body kasi O positive siya eh. Ngayon, aatakihin ngayon ng mga cells and antibodies yung unknown blood na sinasalin, leading to what you call hemolytic transfusion reaction. Intindihan class? So in other words, kasi hemolytic transfusion reaction, this refers to the hemolysis of blood, of foreign blood from due to wrong blood typing, leading to intravascular hemolysis. Okay? Then we have your PCH class. PCH means paroxysmal cold hemoglobinuria. Class, what does paroxysmal mean? Paroxysmal. What does your paroxysmal mean? Any ideas? Okay, it's sudden, biglaan. Then, I think you've discussed this sa AUBF nyo. What does hemoglobinuria mean, class? Uria. The word uria, hemoglobinuria class. Okay, so it's your hemoglobin in the urine. So sa case na to class, kindly write this down in the blank pages. Your paroxysmal cold hemoglobinuria. This is an uncommon Uncommon type of autoimmune class, autoimmune, hemolytic anemia. Class, when you say autoimmune, what does it mean? Based on your immunology and serology. Autoimmune. Auto meaning self, immune. So, any ideas on autoimmune class? All right, very good. Your immune system mistakenly attacks your body. So imagine your class, you're producing antibodies against the very cells na nasa loob ng body mo. That's a very problematic problem pag nagkaroon ka ng autoimmune disorder. So as much as possible. So ulitin ko sa your PCH class, this is an autoimmune, a very rare, uncommon type ng autoimmune hemolytic anemia in which the auto-antibodies are produced to attack your red blood cells. So auto-antibodies are produced to attack your red blood cells in cold temperatures. In cold temperatures. Siyempre, class, kapag inatake yung RBC nyo, magla-lyse yan. Now, sa sobrang dami, hindi yan mafi-filter ni kidney, pupunta yan sa urine nyo. That's the reason for hemoglobinuria. Then, paroxysmal siya. Biglaan, hindi mo masasabi kung kailan mangyayari. Okay? And lastly, class, is your PNH. So your PNH class, this is a paroxysmal, nocturnal hemoglobinuria. PNH. Okay? So class sudden nocturnal hemoglobinuria class. So again, this is a type of autoimmune then that attacks your RBC, but it happens at night, leading to blood in the urine. Next class, we have your haptoglobin, plasma protein that binds to hemoglobin. Now, can combine with approximately 3 grams of hemoglobin. So in hemolytic anemia class, haptoglobin, hemoglobin complexes are rapidly removed. The reason why class rapidly removed sila, remember pag may hemolysis kayo, ang daming hemoglobin na nare-release. Now, yung hemoglobin na yon, magbabind yun ngayon kay haptoglobin. Dahil sa sobrang dami nila, your body will act to remove them, leading to your decrease haptoglobin. Now, class, haptoglobin is also an acute phase reactant, which is increase in inflammation. So your acute phase reactants class, this is gonna be discussed in your CC and as well as in your immunosera. So isa siyang acute phase reactant class, haptoglobin. Next, we have your test for plasma hemoglobin. We have your spectroscopic detection or your Shams test. So this is a blood test class wherein you use a spectroscope to determine the levels of your methemalbumin. So kasi ganito yung class, di ba si hemoglobin nyo, meron yung heme part. Now, kapag yung RBC nyo sumabog, lalabas si hemoglobin. Si hemoglobin nyo, kapag sumabog yan, lalabas yung heme part nyo. Now, sa case na to, sa test na to, yung plasma hemoglobin nyo sinisira. Now, si heme, ngayon nakalabas na, will bind to your albumin, producing what you call methemalbumin. Kapag ang hemoglobin nyo naman class nag-breakdown sa kidney tubules, hemosiderin appears in the urine. Yellow-brown granules will form within the tubular epithelial cells or CAS, while blue granules are positive for Prussian blue reaction. Then we have your mechanisms of RBC destruction class. We have your fragmentation. So imagine class an RBC, loses a portion. So, wasak-watak sila. Yun ang mangyayari. Then we have your osmotic lysis, the passing of water into the RBC leading to your bursting. Then there's also erythrophagocytosis. Phagocytosis kasi, di ba, self-eating yan, cell-eating. So in this case, your RBC are ingested by phagocytosis. Now, meron dito class tinatawag na mononuclear phagocyte system. When you hear that system, what organ comes into your mind? What organ class? Organ. What organ? 90% of our species die this way. What organ class? Mononuclear phagocyte. No, it's not your thymus. Remember the organ where they die, the organ kung saan sila namamata. Okay, it's your spleen. Very good. So it's your spleen class. And what we call the macrophages in your spleen? What do you call the macrophages in your spleen? Okay, very good, Miss Pabingwit. It's your littoral cells class. Littoral. Okay lang yan. Okay, so you have your littoral cells. Okay? So, ganun nangyayari class yun. Your RBCs go into the spleen or the mononuclear phagocyte system. Kinakain sila doon ng littoral cells. Then we have your complement-induced cytolysis. So, your complement class, protein yan na umaatake ng mga dying or foreign cells. So, sinisira nila yung mga red cell. So, 10% of RBCs die this way. Then you have your hemoglobin denaturation. So, kapag na-expose ka yung body mo into certain drugs or certain chemicals, your red blood cell will be destroyed. So next is variations in hemoglobin content class. So we have the different variations class, usually caused by shape of the cell, degenerative changes, and abnormalities of cell formation, particularly hemoglobin synthesis. So we have your key terms class: normochromic, hypochromic, and hyperchromic. So let's discuss first normochromic. So this is RBC with normal amount of hemoglobin. From the word normo, it possesses a central pallor, which is about 1/3 of its diameter. So hypochromic naman class is RBC wherein the central light area is large and paler. So ganyan siya class. Sobrang laki. Parang puro pale siya. I'll show you a picture later. Then there are two types of hypochromic cells class. Hypochromia in normocytic cells. So in erythrocytes with normal So less hemoglobin yung laman. Then hypochromia in macrocytic cells or wherein the size is large. Commonly seen in macrocyte. So normal yung hemoglobin content niya class, pero dahil sa sobrang laki ng size niya, it can lead to hypochromia. Okay? Kasi hindi niya ma-feel yung buong size ng cell dahil sobrang laki. So it can lead to hypochromia. Now, hypochromic cells are usually seen in IDA, hemorrhages, parasitism, and malignancy. Plus, can you give me examples of parasites that can cause hypochromia or anemia? Parasites class. Okay. Slatum. Yes, that's correct, Ms. Johnson. What else? Okay, very good. Necator. What else? Yes, trichoris. What else, class? Ano pa? Okay, schistosoma japonicum is one example. Okay, good. Ano pa, class? Other parasites. Plus, naturo ba sa inyo yung the most romantic parasite? Ha? Naturo sa inyo yun? The most romantic parasite. So, it's your schistosoma. Kasi kaya siya tinawag na most romantic parasite. Kasi class, when the male and female, hematobium ba? Di ba schistosoma dyan po? Hindi ko yung most romantic. If I recall, yung male and female kasi nakapatong sila sa isa't isa. So, very romantic. Kaya tinawag na. And you have your malignancy class. So, malignancy is a first year cancer. Madali lang naman siya tandaan, class, when you hear the word normal amount, hypo, meaning low or decrease. You have your hyperchromic naman. So, these have increased hemoglobin content. So, to the point na ganyan na lang siya, class. So, an example of this class na merong hyperchromic cell is your spirocytes or spirocytosis. Yung cells nila class are hypochromic, but hemoglobin content is normal. Hyperchromic cells are usually seen in megaloblastic anemia and hereditary spirocytosis. I will discuss this class in your anemia topic. It's in the midterms. Then you have anisochromic, so meaning balance both of hypochromic and normochromic. Presence of both hypochromic and normochromic sa same blood film. Usually seen in sideroblastic anemia and iron deficiency anemia after iron therapy. Plus, what do you call the treatment? Or anong tawag dun sa supplement used for treating iron deficiency anemia? What do you call the supplement used to treat your anemia, iron deficiency anemia? Okay, you have your ferrous sulfate. Next, let's go to your variations in staining property. So kanina class, variations in hemoglobin content, ha? This time sa staining property naman. So remember the word polychromatophilia refers to the appearance of cells after staining, while polychromasia refers to the appearance of young cells after staining. So polychromatophilia class, appearance of normal cells or adult cells after staining. Polychromasia, appearance of young cells after staining. Now, let's go to a type of variation, your diffuse basophilia. So when you say diffuse, kalat-kalat or scattered. So this refers to the presence of RNA contents scattered throughout the cytoplasm, stained with various shades of blue, with tinges of pink. And cells are larger than normal and corresponds to reticulocyte. So usually this is seen class in your young cells. Kasi remember, di ba, basophilic siya, maraming RNA content. Tapos, meron pa siyang large pa yung size niya. Then this is usually found in your reticulocytosis, hemolysis, acute blood loss, and pernicious anemia. Then you have another type, your punctuate basophilia or basophilic stippling. This is a special form of polychromasia in which basophilic granules are found in the cytoplasm of the erythrocyte. Kasi anong color ng basophilic granules niya? Do you recall? Do you recall the color? Blue to black. Okay. So imagine yung granules ng basophils niya napunta sa cytoplasm ng erythrocyte. This is usually caused by vascular degeneration. Stippling, kasi class, imagine, pag vascular degeneration niya, di ba may mga vacuoles yung cells niya pag bata pa. Now, as they get destroyed, they form holes. So, yung mga granules ni basophil, kapag nagbara-bara, nagdikit-dikit, imagine, ito yung basophil niya, dumikit yan, nagbara sila eh. Nag-vascular degeneration siya, nagbara, then dumikit siya, mapupunta dito yung basophilic granules. Stippling represents aggregated RNA. And we found in toxic anemia, hemolytic anemia, leukemia, thalassemia, which is a globin chain deficiency, and congenital forms of anemia. Then we have, remember, hypochromasia. So, di ba kanina hypochromic, now this time hypochromasia. So when they are stained class, they appear pale. Hypo, meaning decrease, they appear pale. This can be caused by low hemoglobin concentration and abnormal thinness. So kapag hypochromatic ka, you have low hemoglobin and your cell could be thin, found in IDA and sideroblastic anemia and thalassemia. Hyperchromasia naman class, stained deeply blue due to the thickness of the cell. Found in macrocytosis, spherocytosis, and megaloblastic anemia. So sobrang kapal naman ng cell and sobrang laki. That's why sobrang deep blue yung color niya. And lastly, class, anisochromasia, a proportion of only of RBCs are pale, found in IDA and sideroblastic anemia. And ito yung mga normal values niya, class. 14 to 18 for the hemoglobin, 12 to 16 kapag women, 8.5 kapag women in late pregnancy, children 14 to 26. Convert that to SI, ito yung mga values. And sa WBC class kapag adult, 4.5 to 11 times 10 raised to the 9 per liter. Kapag infants, mas malaki. Plus, na-notice nyo dito, bakit mas malaki yung unit ng normal values ng infants compared sa adult? What do you think is the reason for that? Dalawa na lang yung naka-on cam, si Taras na lang, si Chongson. Ano nangyari sa iba? Ngayon, mas grabe ang kanilang heart rate. What else? There has to be another reason. Plus, bakit sa tingin niya mas malaki yung yung SI, yung normal value ng infants? For development nila, yes, pwede, pero what else? Ano meron sa infant class at kailangan ganyan kalaking normal value nila compared sa adult? No. Just remember, we're talking about infants. Anong meron sa infants class? Tandaan niyo. Remember. Mga baby pa to. Mga nasa loob pa ng tiyan. Mga fetus pa to. Same with your 1-year-old class. Ano sa tingin niyo, bakit? Wala kayo. Organs are still not fully developed, no? Okay, very good. So, classic class, sabi ni Ms. Taras, remember class, pag infant pa kayo, you're very susceptible kahit nasa loob kayo ng katawan or whether katulad nito 1-year-old kayo, kakaano yun, you're very susceptible kasi yung mga primary defense system nyo are not yet developed. So you're very susceptible to infection. You're very, very easy. So sobrang taas ng WBC count nyo to compensate for that. Then you have your normal RBC values. So women, so 5 to 6.2 kapag men, women 4 to 5.5, late pregnancy 3 to 5, at birth 7, infant 3 months to 3 years old. So that ends our discussion